Hello, everyone. Welcome to today's webinar, Long-Term Healthcare, What You Need to Know in a COVID World. We are so excited to be hosting this session today along with LTCI partners. No one wants to talk about long-term care, right? That's why we need to talk about it. Let's introduce today's speakers. Paul King, CEO of King Wealth Planning and LPL Registered Principal, and Steve Kane, Director, Sales and Business Development Leader, LTCI. Steve and Paul will discuss many factors of long-term healthcare, including how it can help give you more choices and more control over how and where you receive your long-term care. Before I hand the mic over to Paul and Steve, I have a few housekeeping items to cover about this presentation and the GoToWebinar platform. First, today's session is being recorded and will be available about a week after the live session and will be accessible through the King Wealth Planning website. And you all know that's www.kingwealth.com. We've also added an attachment, which is available through your attachments area in the toolbar located to the right of your screen. Next, we'd love to hear from you today during the presentation. Due to compliance regulations, the chat feature is disabled. If you have a question for our speakers, please feel free to send it through email to me, Shannon@kingwealth.com, and we will address questions at the end of the session. If we don't get to your question during today's webinar, don't worry, we'll be sure to follow up afterward. So without any further ado, I'd like to kick things off by welcoming Paul King and Steve Kane. Paul, over to you.
Thank you, Shannon. And I was going to say thanks for taking time out from your lunch to all the attendees, but I see we have people coast to coast, so whatever time of day it is, welcome, and thanks for taking some time. Really the purpose of our Healthy, Wealthy, and Wise series is to bring you some actionable and timely information, not to make you an expert in any particular subject matter, but to bring on an expert in a particular area and prompt you to, if it's of interest, to engage with us for more information for your personal situation. So we try to hold them to about 30 minutes, and I want to welcome Steve Kane. Steve, give a quick introduction to yourself and,
Sure.
And where you are.
Sure, I'm down in Los Angeles, suburbs of Los Angeles in Calabasas, California, and 20-year long-term care insurance consultant, and I work with advisors from around the country. When their clients are looking at this type of coverage, we help them examine the options that are available in the marketplace and help them determine if this stuff makes sense or not. So I'm kind of a self-described long-term care nerd.
Yeah, and I know you'll talk a little bit about, you know it from a personal standpoint as well. And I find, with our clients, that's true, is things that tend to prompt the long-term care discussion is a personal situation. Otherwise, it's not always addressed. So we'll get into, how and why we think it's critical for everybody to engage in the conversation about long-term care. Not from the insurance standpoint, right? And I think, Steve, you and I agree on that. It's a long-term care, healthcare discussion, and what do we need to do about it? There we go. So, the thing is that long-term care is a high likelihood for people in retirement or, over the age of 65, and that it's very expensive. So I think we all know that. And so we make it a priority to discuss that, even prior to 65 is really part of the retirement planning discussion. And so, in developing any sort of long-term plan, retirement plan, we're going to talk about outliving your income and money. We may address the estate planning side, but it's that unexpected health event that can really take you off the rails, and why we call it, the biggest risk in retirement is long-term care events. So Steve, why don't you talk a little bit about, as I said, people have sort of a personal situation and they know long-term care from a specific standpoint, but what's the broad range and how do we
Sure.
define it
Sure.
generally?
I think, Paul, I think there's a lot of misconceptions about what long-term care is, and I just want to quickly define it. But before I do that, I want to give everyone a disclaimer. I don't think long-term care insurance is for everybody. I simply don't. You've got to be at the right age, income level. It's got to be on your radar screen in terms of planning for retirement. And it's just not everybody's there at that point. So the bottom line is what I do think is for everybody is planning for an unexpected healthcare event. And Paul mentioned, I've got family experience, and I think we all now have some kind of personal experience or connection to the issue. But again, what I'd like to do quickly is just define what is it. And again, I'm not talking about the insurance. I'm just talking about the delivery of these services. What is long-term care? If I need help with my regular everyday activities for a period of 90 days or more, then I need help with long-term care. So, 90 days is kind of the trigger point, or that's what makes it long-term. But if I need help with my regular activities of daily living for a period of 90 days or more, or if I have something like Alzheimer's or dementia, if I have a cognitive impairment, then I'm going to need long-term care support and services. Now, we'll talk about the setting of those services, and I'll tell you what, all you were thinking, I'm not going to a nursing home. And Paul and I joke about it, neither are we, right? We're doing the right planning such that we're going to be able to stay at home as long as we can. But it doesn't necessarily have to be the catastrophic, like the Alzheimer's or dementia. It could be because of an auto accident, a sporting accident. I mean, every day, I don't know if it's the age or what, but every day I'm hearing about a friend or loved one that's diagnosed with cancer. And nowadays with medical advances, cancer is becoming almost like a chronic illness, and many people are beating cancer, going through these rigorous treatments, but beating it. But think about situations where it doesn't necessarily need to be that Alzheimer's dementia. It could be an accident of some sort, an auto accident, that sporting accident, a farming accident. I'll give you one quick example that you could grab onto. I have a client of mine that's an attorney, very successful attorney here in Los Angeles area, and he was mountain biking in the foothills and took a nasty spill. And this guy's like 52 years old in great health, just very active, and took a nasty spill and had all kinds of fractures on his right leg. And what it required was, over a period of 6 months or so, home health care. It required treatment, rehab, therapy. He was receiving not only disability insurance because he had that protecting his income, but the long-term care insurance kicked in as well. And he had somebody come into his home 4 days a week receiving that type of care. Now, is he going to be okay? Yeah. I mean, I would say like another 3 months from now, this guy's fully recovered. But he's receiving long-term care. And then again, it could be because of the ALS or the MS diagnosis, where if you can't care for yourself safely at home and you can't carry out your regular everyday activities for a period of 90 days or more, then you need long-term care. Let's go to the next one. So where do people receive long-term care? Most of the time it's home health care. When if you look back 30 years ago, how was this care delivered? It was that dreaded nursing home, right? That nobody wants to go to, that smells like cabbage, that people go die in, right? And that couldn't be further from the truth these days. Now, frankly, unfortunately, during this COVID pandemic, that's been the epicenter of death. We've seen roughly 50% of the nation's death take place in skilled nursing homes. Now, there's many reasons behind it in terms of why did people die there, but I'll tell you what, that's nowhere where we all want to be. And if you're doing the right planning, you're going to be able to stay at home as long as you can stay at home. And in the event that you need more skilled care, those adult independent retirement communities, you see these places sprouting up all over the place, these Sunrise, Brighton Gardens facilities, where you live in an apartment, maybe 2-bedroom, 2-bathroom apartment, where you've got a button on the wall and you go press that button and somebody comes in and helps you. That's assisted living. And then of course, skilled nursing is another component of the care. But if I look at where's most of the care delivered, where's 70-80% of all care delivered, it's at home. And frankly, that's where we want to be. And being on this discussion today and talking about it with your loved ones and Paul is going to enable you to maintain the lifestyle that you've grown accustomed to over the years. And we just want to make sure you got a plan to deal with this in the event that it does happen. I do think, and this is just a consultant's opinion after a guy that's been in the industry for 20 years, they've got to hit Control Alt Delete and blow up the nursing home delivery of services. I think it's broken. Many of these facilities don't get reimbursed nearly as much as it costs to take care of recipients and patients in there. And so you get into scenarios where if it's a Medicaid or Medi-Cal facility, it doesn't have the same level of service and care as you see with private facilities. So what I want to tell you is where do you receive care is really up to you, your loved ones, your doctor, and if you're doing the right planning, that's going to be at home. And then again, if things progress, you've got assisted living and skilled nursing as well.
Yeah, this continuum of care really is in that order. Most of the care starts at home. Maybe you need assisted living. If you need a nursing home, it's typically at the end of life. It's not the bigger part.
That's correct.
And I think, you know, in my career, the 30 plus years watching long-term care, you know, calling myself an expert in it, have seen this delivery system and services, especially around in-home care, just explode and, you know, become much more prevalent, and our planning is around that.
Well, I want to mention one other thing on this. You know, we all think of the catastrophic, right? You know, you think about being in a nursing home for many, many years, and we know that's just not the case. People are staying at home, but how long do people stay at home and need care? And we've seen, as I see new studies commissioned, and we read through those reports, the length of time needing care is lengthening, meaning we're living longer. You know, we've got advances in medicine and technology, and the way we're eating and exercising is better than previous generations. So we're living longer while receiving more long-term care. But today, let's talk about today. The average duration of care is about 3.5 years or 3 years for women, and about 2.5 years for men. Right? Women live longer while receiving care. We just don't. I don't know, Paul, if it's we don't listen to the doctor or go to the doctor. I'm not sure if it's that, but that's how long are people needing it. And then of course you're going to have the outlier where somebody's diagnosed with Alzheimer's, and you know I've got family experience in that, and I'm very active in the Los Angeles Alzheimer's Association, and the average lifespan for somebody that's diagnosed with Alzheimer's is about 7 years.
Yeah.
And so much of that's going to be needing care, and that's tough. Let's go on to the next one.
Your statistic on here, the 1 out of 7 needs more than 5 years. So when we do our planning, you know, the clients we work with typically can withstand, say, a year of cost.
Yeah.
But beyond that, it starts really impacting everything we do. And 5 years is devastating. And 1 out of 7, that's a pretty large chunk of the population. So and we have statistics, right? The year plus, the average. But just know that it's a high likelihood that it's going to impact your plan. So you need to really address it.
You know, I statistics, right? We all see them in all these reports, and we don't want to bore you with them. I joke around that there's either 100% chance that you're going to need this or a 0% chance, right? But it's our job to educate you about what this stuff is, and so that you can make a determination. Does it make sense? You know, does it make sense to look at insurance? There are other ways to pay for it, which we'll go over. So this I just want to bring up because I know we got people from all over the country, that the cost of care varies from city to city, from state to state. If you're in California today and you think about retiring in Arizona, it's going to be a little less expensive for the delivery of care. If you're going to be in the Eastern Seaboard, it's going to be more expensive than it is here in California. So we keep our thumb on the pulse of what the average costs are for home health care, for assisted living, for skilled nursing. Don't get scared off on the key to this map here on the right-hand side of your screen. That's a private room in a skilled nursing facility. If you're looking at home health care costs, they're likely going to be half of that, if not even less. And again, that's what we're seeing. I'll give you a real life example. My mom is 80 years old, lives at home alone, but with some help. Boy, has it been tough just navigating the delivery of healthcare. for somebody that needs it, just interviewing the home healthcare agencies, interacting with physicians, and determining her plan of care. And then you factor in COVID, and man, it's been tough. But right now we're paying $26 an hour to a home healthcare agency. It is the third agency that we've used, and I think we found the right one, but we had issues with the other two in terms of consistency, in terms of the delivery of care that they were providing. And they have minimums in terms of how many hours they require somebody to come into the home, because they want people staffed. And so it's like $26 an hour, I think, for 4 hours a day. And I think we're doing it right now 3 days a week, but we're thinking about extending it. And so I just want to give you some ballparks, but Paul and I have calculators, tools to keep our thumb on the pulse. And Paul, what do you do when it comes to planning, when you're projecting out costs? Do you look at, hey, here, if we had a 3-year event 20 years from now, what do you do?
Right, exactly. And as part of it is this personalized conversation, because we have to take into account family situations, right? There's ways of controlling cost, especially home care costs. We can't predict what the health event's going to be. That's more statistical. But who could care for mom, dad, for yourself if something happens, right?
Yeah.
So we have families where the children are local and they will come in and share some of that time. If it's delivery of medication, if it's helping mom, dad get in and out of bed,
Yeah.
they can do that. Some things require more health aides. So we get into that family situation and project the cost from there, right? We could do the worst case event, which is these numbers, but that's not really fair, right? It's more, if your individual situation would happen, what would the plan of care possibly be? So I think we modify it from there.
Got it.
And especially home health care can be very sporadic and periodic, like your situation.
And I'll tell you what, like, we did what most families do, right? You step in, you step up, and help out. And my mom ended up, after an open heart surgery, moving into our home. And I've got 2 young daughters and a wife, and essentially, because of my work and business travel at the time, my wife was caring for almost like 3 kids, right, instead of 2. And so there's a financial component to what you're seeing here in terms of protecting your retirement income. And then there's also a caregiving component, which we weren't ready for that challenge. We had to learn as we went on. And then there's an emotional component, seeing your loved one might be compromised or might be vulnerable. And frankly, Paul, we got to the point where my mom was the one who said, I got to get out of here. Once she got well enough, she didn't want to be a burden on us. She wanted to move back into her home, and we felt it was most appropriate or suitable to get somebody in there a few days a week too.
Exactly.
Yeah. So again, this is stuff that Paul, can go over with you in terms of the projected cost. We're showing probably the worst case scenario in terms of a private room in a nursing home, but this, proper planning, whether it's with self-insuring or insurance, puts up kind of a firewall between you and your 401k or your retirement income. That's the way I look at it. You've spent your life making all the right decisions as it relates to your finances and your healthcare. Make the right decision here too, in terms of planning for a long-term care event, because once it's too late, you have no options. And man, I must be a terrible salesperson, because I didn't sell my parents long-term care insurance, right? And by the time my mom came around to it, she was uninsurable. And so when her heart attack, when she had the, not heart attack, the valve replacement that had complications afterwards, Medicare did a great job, and we're going to get into that in a minute. And it paid for it, but then it stopped. And my brothers and I were looking at each other going, okay, now what? What do we do in terms of the financing component? And I did what Paul tells me not to do. I did the stupidest thing ever, where I rated my 401k. I paid a 10% penalty, and then state and federal capital gains because of the growth of the 401k. And it cost me $24,000 just to get liquid, just to find the money to then pay for the home health care. And then you're like crossing your fingers going, okay, brother, that I was talking to, I'll handle the first year. If it goes beyond that, you're on the second, and third, you're on, and my third brother, the other brother, you're on the third year. And that's what we're going through right now. So I'm just saying there's better ways, and that's why I commend you all for being on this discussion today to learn about them.
Well, I think you brought up a good point about the tax effects we hadn't thought about discussing, but just know that there's some of the long-term care funding solutions have tax components to it that are also pretty major. And you're saying is locate where the money's going to come from.
Yeah.
Some of that can be repositioned in a much more tax advantaged way because the cost of care, cost of long-term care may not be taxable. So some interesting things when we look at an individual.
And this is tough. I mean, Paul, this is tough. You're looking on this screen, it says in 15 years and 30 years. That we have to plan 15 or 30 years ahead of time, right? Because there is no plan at the point of need. So that's the hard part in all of this. Like you said before, and like Shannon said, like nobody wants to think about it, but we get calls every day where unfortunately it's too late.
Well, and in the fine print down here, it's assuming a 4.1% annual increase in cost. And we know healthcare has been going up faster than normal, cost of living. And that's the
I think it's supply and
separate entity.
Totally, and it's supply and demand, right? We've got this huge baby boomer population that's aging, and these agencies are going to be able to charge more just because of the demand.
Yeah.
So let's talk about financing. So what we've really covered thus far is that longevity is a risk. First of all, it's awesome. I wake up every morning feeling like, thank God for the life we lead, and we're going to live longer than our parents did. And despite what's going on with COVID, I'm still an optimist. And the bottom line is, because of these advances in medicine and science and technology, we're going to live longer. And so that means we've got to plan for it. So as it relates to longevity risk, how do you plan for it? How do you plan for this long-term care event that might happen to myself or a loved one? Well, there's Medicare, and Medicare is a fantastic program, but it wasn't designed for long-term care. It was designed in 1963 when the average lifespan was about 70, and it was designed for acute care, nurse you back to health. It was not designed for anything beyond 100 days. So in Medicare's own guidebook, each year it says don't count on Medicare as your primary source for long-term care funding. And there's a misconception out there. We all think, hey, this is what I'm paying taxes into. Medicare is going to take care of me. Medicare will cover 100 days in a skilled nursing facility. Medicare will not cover home health care. Medicare will not cover assisted living, skilled nursing only for 100 days. And then the first 20 days, Medicare covers 100%. Days 20 through 100, there's a copay. Again, good program, but not designed for long-term care. I mean, all you have to do is turn on the TV or turn on the radio today, and you will get like 100 Medicare supplement commercials, right? Those are good products too, but what they do is they pay for the co-payments for Medicare A and B. And they don't pay for long-term care services. That's not what they were designed for. I think those are valuable products, but just not for long-term care. Then you've got Medicaid, or in California, we call it Medi-Cal, and that is a state and federal needs-based program that essentially pays for long-term care services, again, only in a skilled nursing home, not for home health care, not for assisted living, only if you're at the poverty level. If you've divested all of your assets, going down to $2,000 in most states, aside from your home, car, wedding ring, and burial money. So it means, hey, this is like a last resort. I haven't done any of the planning. I've got nothing. And then the federal government steps in. And no free rides. The federal government's getting a little bit more aggressive, and this is before Trump. Federal government's getting more aggressive as it relates to recouping those assets. They're sending letters to heirs saying, we spent this money on mom and dad, we want it back. And in 20 states, they even go as far as putting liens on homes to recoup those assets. So like no free rides. And again, a lot of people.
In my career, I've had no clients that want to plan on Medicaid making those payments.
Nah, I mean, come on, it's a last resort. If you're on this call, you're doing the right planning, so it's not going to be an option for you. But what I did want to highlight on this is just that Medicare is a great program. My mom was in hospitalization with her surgery, went well. She had complications, so she was in a skilled facility for a few weeks, and then the doctor said, "Hey, Steve, great news. Mom's plateaued to this point. She's not going to, be a 50-year-old anymore." But she's well enough to go home, and that's when Medicare benefits stopped, and we had to figure it out on our own. So essentially, we got to do this as a country. This is not just King Wealth. This is like our country's got a big issue as it relates to long-term care. I'm very active in the long-term care insurance industry. I meet with legislators a couple times a year in Washington, D.C., and there's absolutely nothing, whether it's Biden or Trump, on the plate that says we're going to pay for long-term care. It's up to us either to self-fund or to look at insurance. It's as simple as that. If you're self-funding, one thing I want to mention is, and that's like a viable option for a lot of people. I mean, Paul and I deal with a ton of people that says, hey, you know what, we've got this money set aside, we're just going to self-fund. I would just ask that you think about 3 things that I didn't include on the slide here: timing, liquidity, and healthcare. Timing, I don't know when my long-term care event's going to happen. It could happen during a recession, or it could happen during a bull market. And so we just don't really know. Liquidity, were you like me, where you weren't liquid to the tune of an extra $4,000 or $5,000 a month? Is your money tied up into the stock market, into business, into real estate? You might not be able to get that money quickly to pay for the care. And then again, healthcare. I always tell people that managing a long-term care event takes more than money. Right? Somebody's got to get their hands dirty and deal with the physicians and deal with the agencies or the facilities to ensure that your loved one is being cared for the right way. So just think about that if self-insuring is something that you've done thus far or are considering in the future.
Mm-hmm. Well, and I think, essentially people are paying on their own. The question is, can we use some products and services that will enhance that, will leverage your money and your, towards this cost of care. So that's why
Yeah,
I look at it.
Is there a more effective way to self-insure? Right, I'm right there with you.
Yeah.
So here are the questions that you got to ask yourself. Where are they provided? I think you know that, and you want to be at home, right? I don't even need to put that question up there anymore. So what effect would this have on your family? Have you talked to your adult children about this stuff? Because most of the time it's, yeah, my kids will take care of me. And the question I ask people is, do they know? Have you talked to them about this? Because it would have been easier. My brothers and I would have probably pushed to purchase insurance earlier, or maybe created a real bona fide strategy to deal with this. And then you got to think about what's the effect on my retirement strategy. If I know I have X amount of retirement income coming in, what if I have to divert that to pay for long-term care? What kind of, would that infringe upon or change my lifestyle in any way? Paul and I could give you what the cost might look like today and down the line, wherever you live. And then what are the options? And frankly, I think the options are pretty simple and easy. You either self-insure or you buy insurance. It's really that easy. So let's flip to the insurance. But before we do that, Paul, when you're positioning this, how are you positioning it in conversations with clients?
Well, this is it for, we say we focus on retirement planning, and retirement's different for everybody. I think of it like juggling, right? You got all these balls in the air, and we're trying to deal with all of them, and which one you don't want to drop? Well, none of them, but this is a critical one. And so it's just got to be included in the overall conversation, especially once you're, say, past age 50, it starts getting real.
Yeah.
And
Yeah.
so we just incorporate it into the overall conversation.
Got it. So, as it relates to insurance, I am the insurance guy that hates buying insurance, right? Like, it is just like a necessary evil, right? We all have hopefully medical insurance. We're required by law to do so now. With auto insurance, same thing. Even if you own your own home outright, you still have homeowners insurance. And so the way we think of long-term care insurance, the way I want you to think of this, is that it's protecting your retirement income and it's protecting your lifestyle. And I'll tell you what, your family will thank you that you've thought about this planning in the event that somebody needs it. All right, so hopefully at this point, because we're just wrapping up, we'll be done in a couple minutes. You understand that you're going to live a long life, and if you do, there are consequences, many positive consequences, but also some risk that you have to deal with, and that's longevity risk. And the biggest ticket spend or item in retirement planning in terms of healthcare is long-term care, right? We're all worried about healthcare and retirement, and this is the biggest ticket item. So you got to develop a strategy to offset this risk. That strategy could be your family, or that strategy could be long-term care insurance. It could be self-funding, or it could be long-term care insurance. If you're lucky, you might get a little bit of Medicare, but really, this is about, hey, let's either examine long-term care insurance or look at self-funding. And when I say self-funding, don't just say, yeah, we're going to self-fund and stick your head in the sand. I mean, put it as part of your estate plan. You know, have a document that says this is what we're going to do, this is where we're going to get the money to pay for the care. So let's talk about the insurance, and I'll keep this simple and easy. How does the insurance work? I don't care if you're talking about pure traditional long-term care insurance or these combination policies, which we're fans of, that combine life insurance and long-term care together. Here's how this stuff works. You give money to an insurance company. That insurance company will turn around and invest that money into very conservative bond portfolios. By state statute, these insurance companies have to take about 60 cents on every dollar you give them, and it goes to reserves to pay future claims. So they can't touch this money. And when and if your doctor says that you need long-term care services, either you're unable to perform your regular everyday activities, or you have a severe cognitive impairment, something that's going to last for more than 90 days, then you receive long-term care benefits. Essentially what you're doing is you're creating a pool of dollars, and Paul and I work together to design these long-term care plans. But essentially you tell the insurance company, hey, XYZ insurance company, if and when I need long-term care services, I want you to cut me a check for $6,000 a month for when I need it. And you can use that for home health care, for assisted living, for skilled nursing. And you also get to tell them how long you want it to last. So essentially you're building up this pool of dollars. It could last for 3 years, for 6 years, for longer. It really depends on how much you start with in that initial pool. And then there are inflation protection components that grow the benefits and value over time. So if you did buy it at age 50, like Paul mentioned, that it would be worth something at age 80. And you also see on the right-hand side care coordination. That's a critical component to these policies. You have access to registered nurses, licensed vocational nurses, geriatric care managers. They're not like gatekeepers like HMOs. These are consultants that you have access to, so they could hold your family's hand. And boy, what was the money was painful. Don't get me wrong when I talked about my mom and finding that money to pay for the care, but equally as painful was navigating the healthcare system. And included in these policies is this care coordination services where you can lean on a professional who eats, sleeps, and drinks this. They'll set up interviews with the agencies, they'll negotiate discounts on your behalf, and they'll manage, monitor, and adjust the plan of care over time.
Yes.
So that's essentially how this stuff works. And again, if you have the life insurance combination plan, it just adds some life insurance to what I just talked about too.
And that's an area we can discuss individually. Is just that's what I was talking about. The pool of dollars can come from an existing life insurance policy that we can reposition, annuities, cash. You know, there's a lot of different ways we can get to this, you know, coverage.
So
And I think
again,
this is where, you know, over my career, it started out as long-term care insurance, just the in your first column here. And then it's just, you know, expanded to fit needs that people had. The government has stepped in with new laws and regulations and tax benefits. And that's when it became so complicated that we've had to, you know, engage with Steve and his company, LTCI Partners has been just a great partner to keep up with all of this. So when we have a client situation, I can paint the picture of what that might work for this client. Steve and his company step in, design some options, we discuss those with the client, and that way we land on the, the solution that works best in that particular
Yeah,
situation.
I'm not. Paul can go into detail in terms of each and every one of these products. I'm just here to say there are more planning solutions than ever before in my career. I think every insurance company in the industry recognizes that we need to solve problems as it relates to long-term care support and services. So we have a number of different ways to solve the problem. And what Paul will do is just do some fact finding with you and have conversations about what's important to you and how, if you were to look at this, how would you pay for it? And that kind of leads us down a path. And again, multiple insurance companies that he represents to deliver these types of solutions.
Yeah. There's no one right answer, that's for sure.
No. In fact, all these people ask me all the time, what's the best product, right? I get that question all the time, and I'm like, it's the one that works at claim time, right? The one that pays claims, and not being evasive. It really is. It depends. So I would just encourage you, if you think this is important, if you want to look at numbers, reach out to Paul and have a conversation. No obligation or anything like that. Just see if this type of coverage makes sense for you.
And similarly, we try to keep track of professionals that can help in those kind of questions is, what are my options for living situations? What kind of home health care can I get? And so if you need any of that kind of preliminary discussion coordination, reach out to us and we'll get you who we know as well, just like Steve. Shannon, turn it back to you. Do we have any email questions?
Not at the moment. Let me remind participants to email questions to me at shannon@kingwealth.com. As I mentioned at the start, today's presentation will be available after the session and is accessible through the King Wealth website. Let's give people a couple minutes here.
So Steve, I have a question. You mentioned, either candidate, doesn't matter. We don't see anything new coming down. Can you foresee any changes in whether it's the insurance area or nursing home reform? Because especially with COVID, it's been a disaster, and
It's been a disaster.
There's got to be a national dialogue on what that is.
Yes. In fact, the last, it was probably February before COVID that I was in DC meeting with the Senate Committee on Finance, right? And our goal was to create a hearing. I didn't expect any legislation just based on the gridlock and an impending, upcoming election. And now we've re-engaged them after COVID or in the midst of COVID because of the death and that being the epicenter. And so I think this goes beyond insurance now, right? I started out talking about how do we create more tax incentives. That's when I would usually go to DC and talk about how do we encourage the purchase of more private insurance. And now my agenda's changed. I want to hit Control Alt Delete or blow up how we deliver that type of care because it's not acceptable. I mean, whether it's the low wages that are paid to caregivers in those facilities, it's caregivers that were working in multiple facilities. So you had asymptomatic carriers going into multiple facilities and infecting nursing home residents, and then hospitals putting people back into nursing homes. So it was just a perfect storm.
Well,
But I
and
think
one of the great tragedies too was keeping loved ones who are the gatekeepers for that particular person out, right?
yeah,
They
yeah.
didn't have access even to, and it's just, that can't happen.
But Paul, I think to your point, this is starting a national dialogue. I don't have concrete steps. I just know that last week, and I have a monthly call with a lobbying organization that I'm a part of, and that's our dialogue. It's not strictly long-term care insurance anymore. We're talking about how do we take care of moms and dads and loved ones better? This goes beyond insurance. So I hope to report back, to you some news in the next 6 months or so.
Yeah. Well, and I said we cut this off at sort of half an hour, and but Steve and I, when we get on a call, it's kind of hard to stop us from from going on and on that, you know, long-term care and senior care needs is such a critical part of what we do. And we have put an emphasis on health for years because it is really the number one topic people talk about when they come in. They talk about money, but the most important thing is health. And as much as we can do to help maintain that and plan for it throughout life, we're here for that. So Shannon, if you have no questions, I think.
Yeah, no question. You both did a phenomenal job covering everything, so nobody has any questions. And I just want to thank everyone for logging on today and joining us. And thank you, Steve, and thank you Paul for your expertise. And if anyone does have any questions later, just shoot me an email and we'll take care of you.
Thanks, everybody. Have a great day.
Thanks, Steve.
All right.
Bye, everyone.
Bye.